right, welcome everybody to another episode of Mind Your Health podcast. I'm your host, Dr. Mina Merho. I'm a board-certified psychiatrist, assistant professor of psychiatry at Columbia. And today I am delighted to have my good friend, Alyssa DiLeo, psychotherapist extraordinaire at Train Your Brain, right?
Let's train the brain.
Let's train the brain on Instagram. Make sure you follow her. And we're going to get into a topic today that I was actually surprised preparing for this podcast, that the amount of people in the country that are dealing with this. I didn't realize that the number one cause of long-term disability in the States is chronic pain. And 20% of people in America are dealing with this on a day-to-day basis. And people may not always realize how, your mind impacts the pain that you go through and your whole sort of journey. So we're going to explore, both your individual journey, a bit of, things that we can learn about from therapy, because I know I've had a ton of patients who are dealing with chronic pain. So I'm just so excited that you're here. Welcome.
I'm so excited to be here. Thanks for having me.
Yeah, of course. So let's start off with this. I know before we get into the stats and we had the big opiate use disorder, as doctors were saying, 5 out of 5 docs recommend taking Percocet, and we sort of created a big problem.
Yeah.
Before we go into all those things, maybe tell us a little bit about your individual journey from a health standpoint. How did sort of things come to be that you were interested in this topic in particular?
I became interested in this topic because I went through my own journey of chronic pain, and it wasn't just chronic pain. It was chronic pain. I guess the umbrella term that they used for me was fibromyalgia.
Ooh, big one.
So fibromyalgia, chronic fatigue syndrome, and irritable bowel syndrome. So 3 different chronic illnesses.
It's trifecta.
Yeah, so that started coming about in 2016 after a series of emotional stressors, and wasn't quite sure what was going on. So I went to a variety of different doctors, 8 of them actually.
Wow.
And yeah, so over the 8 different doctor visits I had, I received those 3 diagnoses, and I was told, this is kind of your fate. You can manage it through medication and you can manage it through lifestyle changes, but we don't know the cause and it's incurable.
Nice, which is very optimistic, I think, for us in medicine.
I know, right? So needless to say, I left very, very defeated after every visit.
Did you feel like even when you were going, because I know patients tell me this as like a young, healthy looking woman, were you sort of dismissed? Were you like, oh, come on, like, you're fine, everything's okay? Like, even to get a diagnosis, did you feel like it wasn't a validating process?
Yeah, I definitely didn't feel like it was a validating process. And I think that's the case even more so with women. As a younger woman, I was relatively fit at the time too, which I think created even more of a bias. So I don't think that helped my situation at all. But I will never forget, I think the biggest incident I had with this was when I had a cortisone shot. And I went to the emergency room. And it was an emergency room that I frequently visited.
Okay.
Because I was trying to figure out what was going on.
Right.
I was desperate for answers. And I had a cortisone shot the day prior to try and alleviate pain in my chest. And my lung collapsed. They punctured my lung.
Oh my goodness.
Yeah. And being that I was so minimized, I started minimizing myself. And I told myself, you know what? It hurts, but apparently to doctors, that's normal with the condition I have. So I waited an entire day to go to the emergency room. I got out of bed the next morning and was like, well, not only did this not help, I felt something move inside of me. And I was like, that's not good.
That can't be good. That can't be right.
Drove myself to the emergency room, and I'm perceiving their thoughts were, all right, this girl again.
Yeah.
And I just felt the dismissiveness. And, they had to put the chest tube in me and reinflate my lung. And I'll never forget looking across the room to the nurse that was the most dismissive. And just my gaze, it was like, Told you. Like, don't do that.
Wow.
Yeah.
Let me tell you from the flip side. So I've worked in the ER as a psychiatrist for years and interacting with ER docs all the time. If we're seeing a young, healthy appearing female with chest pain, the overwhelming feels like, oh, she's anxious. You're gonna give her Ativan.
Mhm.
She's having a panic attack. No one's thinking you drove yourself to the hospital with a punctured lung.
Right. Right.
And here you are in like real pain. And the medical gaslighting was pretty real at that point.
Yeah. Yeah. I'm hoping that that changed her mindset a little bit.
So
Yeah.
just a little, hey, I caught you. You see me, I see you.
Yeah.
Did you, when you were coming in, did she personally kind of treat you in a way that was like, come on, be a big girl? And, or was it
It
more
was
so
an energy. I just felt
a
an
vibe?
energy that, yeah, it was a vibe.
Yeah, yeah.
We can pick up on that on an intuitive level.
Mm,
Luckily, the guy that treated me wasn't like that at all. The ER doctor was incredible. I think he had a
okay.
feeling that something
Ah,
was actually going on. I don't know how he knew. I don't know if it was the way that I presented, but he was great. So I was
nice.
very happy to be in his hands. He was probably the best doctor that I had throughout the entire journey.
Wow, shout
Yeah.
out to that doctor, whoever
Yeah,
he
I
is.
forgot his
We
name.
should
I
have
forgot
shouted
his
him out.
name. I wish I knew, but he's
So the
awesome.
internet can be
Phelps ER. I don't
okay,
remember his
okay.
name, but yeah.
Because that makes a big, but that's a good point because the highlighted difference there of when somebody is going beyond the most classic presentation in a textbook, right? So someone comes in like this, it means that they have this, and they're looking at you as a person and seeing what could really be going on here. A little bit of medical intuition, right? Like just kind of trusting that something isn't right, doesn't add up. And that sounds like it made a big difference for that doc and the way he approached you.
Absolutely. And I think that that is probably one of the most, I would say, it's the biggest, one of the biggest missing ingredients
Mm,
with doctors when someone comes in with a chronic condition.
let's talk about it. I know how doctors are a little, how shall we say, we're missing a lot when we're talking with patients, right? What do you feel like are some of these missing ingredients with docs?
I think piggybacking on what we were just saying, is looking at the person as a whole. They're
Mm,
coming in with
mm,
these problems,
hmm.
and I know doctors don't have a lot of time, and I know they're not that well trained, so I understand it's not their fault.
Yeah,
I'm a therapist. If someone came to me and they had, you know, they needed an adjustment, I would
right,
have to
right,
refer them out.
right, right, right.
So I think maybe sometimes doctors, if they don't know the answer,
Mm,
it's okay for them to say, you know, we're not that well trained in this. I'm not really sure. Maybe a health psychiatrist or a therapist
mm,
or someone trained in the mind body connections.
right, right, right.
Studies have shown that stress can increase physical symptoms, chronic illness, etc.
Definitely.
And looking at the person as a whole, and getting a little bit inquisitive too, like what's been going on in your life for the
Mm,
past year, maybe leading up to this, and even
yes.
expanding the client's mind.
Right.
That's obviously after ruling everything out physically.
Well, let's talk about that for a second. Just the diagnostic process, because I feel like, especially, in psych, we get a fair amount of training in neurology. So we come across fibromyalgia, MS, other chronic pain conditions, chronic fatigue syndrome. And sometimes what we see is that when someone presents with these symptoms and there isn't a clear explanation and not a lot of really clear digging, people just kind of throw their hands up and be like, this is probably fibromyalgia. Here's Neurontin, here's one of these medications that
Yep.
hopefully will help you. When it comes to actually diagnosing somebody, I know you mentioned looking at the bigger picture of what's going on that past year or like expanding their mind. What are some things that you felt like you would have wanted a doc to ask you, but they never did?
I think what I said a little while ago, what's going on in your life? Have
Mm,
you ever maybe thought that maybe there's some interconnection between the two things?
mm,
Maybe even giving examples of people. Like, I know
mm,
it's not everyone's case, but I had a patient just to open their mind a little bit because I
hmm.
didn't have really an open mind. I
Right.
was very stubborn in the fact that this has to be physical and that there's something
Mm,
missing. And I think a doctor, white coat, has a lot of power.
right.
So what you say to your
Or blue
patient,
scrubs, whatever. Like,
yeah, yeah, or scrubs, it really has an influence
mm,
on their mindset and their belief in their ability to heal or to
mm.
remain stagnant and not try anything.
That is so true. And there is a lot of data that we have that sort of reinforces that, that our mind has this ability over our body, right? And it's interesting, I think, from your vantage point, even as a therapist, knowing the impact of therapy and how this impacts somebody's mind or somebody's life, rather. but still there's a desire sometimes as a patient to be like, this is not in my head.
Right.
Don't throw this as like a psych thing.
Right.
Something going on in my body.
Yeah, I think a little bit of psychoeducation for the doctor and the patients, that even though it's a very real physical sensation that you're experiencing, you're
Mm,
not making it up. It isn't all in your head. It's well, it's your nervous system, right?
right, 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 right.
It's essentially your nervous system. So if your nervous system feels inherently unsafe,
Mm,
it's going to perceive that as an actual physical threat. Your
right.
brain can't tell the difference between an emotional threat
Mm,
and a physical threat. So I think if someone can even just grasp their,
mm,
you know, their head around that a little bit.
yes.
So what happens is, if you feel perpetually emotionally unsafe, then your body will respond as if you're under physical attack. And
Mm,
that's how these syndromes come about without necessarily an injury or some type of physical abnormality.
mm.
Or sometimes, even if there is a physical abnormality, that fear and that obsession and that preoccupation will perpetuate it.
Can you give me an example there? I know a lot of people are going through, we talk about the impact of trauma. There are these books like The Body Keeps a Score, things like
Yeah.
that, right? What does it look like? Maybe what it look like for you or patients that you've seen when they go through an emotionally trying or traumatic experience, and how that can relate to how they feel physically. Talk me through maybe an example of that.
I'll give you my personal
Yeah,
example. I think that that
sure.
might be best. So I had a series of emotional traumas.
Mm,
They weren't big type T traumas. They were
mm,
a series of small type T traumas that accumulated over a long period of time.
mm,
And then eventually it wreaked havoc on my nervous system.
mm,
So at the time I thought, "Oh, I'm just like burnt out at work." I wasn't really making the connection, but I have
mm,
a very inquisitive personality. So I started delving into mind body connection.
mm,
I stumbled upon Dr. John Sarno. I don't know
mm,
if you've heard of him
I
before.
haven't. No.
Yeah, he was kind of the guy that started
Okay.
this whole mind body syndrome. And it really just opened my mind to the fact that, wow, my emotions and this trauma, or
Mm,
these traumas that I've endured, actually created these physical
mm,
symptoms in my body. And if I could just make my brain feel safe
mm.
and rewire my nervous system through neuroplasticity, we know that the brain can change throughout your
Right, right,
entire
right.
lifespan, then I could heal myself. And then I just went down that rabbit hole and I figured out how to do it. And
And that's been a big deal.
yeah,
I really like what you're mentioning here because sometimes people think about a traumatic experience or something, terrible that happens. Sure, I had a friend recently who told me he was in a car accident where it was like a near death experience and he began to experience physical symptoms, right? Something that was where he almost died. But people don't think about the cumulative effect of how things add up. And sometimes when you have a bunch of small stuff, a breakup and your boss is a jerk, and one small thing after another, but they start to layer on
yes.
and it really hit you.
Yeah, it's usually with these types of things, it's the perfect storm. Maybe there was some stuff going on in childhood, maybe it's a bad relationship that you're
Mm,
going through, maybe your job is super stressful, or it could be one big type T thing.
mm.
Usually you will see veterans that have PTSD, their
Mhm.
brains are stuck in that fight or flight and they're
Right.
looking at everything through the lens of fear.
Right.
So that usually co-occurs with their PTSD as well, chronic pain. And it just goes to show you that the pain centers in their brain are activated
Right.
and it's a misfiring. They just need to learn how to shut down.
Right. To just go a different pathway because you're
Yeah.
to your point about this being in your head. I mean, it's like a silly but obvious thing. People forget that in your head is your brain, and your brain is an actual organ that has real pathways, and it's the way that the rest of the body is being directed. The chorus there is so it's not something. I think a distinction that people often have a hard time making is between your mind, your thoughts, your imagination, things that are in your head in that way. For us in psychiatry, this was a big thing too. This is one of the reasons why the big push to biological psychiatry, when we were trying to say, okay, don't just lay on the couch, tell me about your mom, but let's talk about things that are brain based, organ based.
Yeah.
And it's like, hey, this is real medicine. What your brain does to the rest of your body is a real connection.
Right.
And it sounds like you really saw that as well over time.
Yeah. Yeah. Absolutely.
I love that. So let's say once you were getting this diagnosis and once
Mhm.
you've gone to those several docs or should have been a bit more curious, once you felt like, all right, there was this terrible prognosis of, either, because actually, let's talk about that for a quick second. I know some of the things, even when we were preparing, that we were talking about earlier, when somebody gets a diagnosis of fibromyalgia, somebody gets a diagnosis of chronic pain, the traditional approach in therapy is focused around what? I know you were telling me this before, around acceptance, right?
Right.
Tell me a bit about that. Why that's the usual traditional route that we take. Like, here's how to deal with your issue.
I think there's a lack of education
Mm,
amongst society in general
hmm
that these type of illnesses can actually be cured,
mm,
or at the very least symptoms can dissipate and
hmm
decrease in
hmm
severity.
hmm
So because that is not spread enough and people don't know that the nervous system is malleable and
mm,
creates sickness but can also bring you back to vitality and restore your health.
mm.
The same brain that makes you sick is the same brain that can heal you.
Right, right,
And I
right, right.
think that because of that lack of information, doctors can be quick to just hand out medication
Mm,
and just say that this is something that you're going to have to live with forever.
mm.
And lifestyle things can improve that a bit, but literature kind of says that this is,
Mm,
and like if you type it into Google, it says lifelong.
wow.
And so even if you just think placebo effect alone, that's going to leave someone plagued in just victim mentality and they're
Right.
not even going to do anything. But I think from the therapist's point of view, a lot of them also don't really know and
Mm,
understand quite how these things come about.
mm,
I think that they understand to a degree that it plays a role,
right.
but I don't think that they understand that it could be completely reversed and
Mm,
how to actually go about that process. So they take more of an approach of, how can we get you to accept that this is what is going on
right.
and make the best of your life given this hand that you've been dealt?
Mm,
When I think that the approach should be, we're going to accept this for right now. This is what is going on right now, and you can't change that right now.
right, right, right.
But you can change the trajectory of this illness, and you can self direct changes in your brain
Mm,
to heal your body. And so you do that through a series of different
right.
processes, mind body processes.
Yeah, I like that a lot. I remember a friend of mine gave me a book called Flourish. Have you ever come across this
No.
book? But it was basically highlighting this issue of how, for us, maybe in healthcare in general, but in mental health in particular, our whole paradigm is around like stabilizing people, around having things be like good enough, right?
Right.
Like you're stable enough to leave the hospital, you're accepting enough of whatever your medical condition is to function. So you can keep going to work, you can keep doing your thing. But it's not around flourishing or thriving or growth of how do you actually change these things. And it's like not very empowering. I know if I was a patient and I go to a doctor or I go to my therapist and they say like, this is just the way it is, man. Just like learn to live with it the best you can. That sucks. I don't want to live that way.
Yeah.
And it sort of foregoes all this hope of, here are all these choices that I can make that can make a real difference in the way that I feel, right? And that's a very different paradigm, I think, from the way we're usually practicing medicine.
Right. And sometimes all you need is one single person to say, "Hey, like I know
Mm,
someone that was
right.
cured," or there are actually things that could be done to rewire your nervous system and
Yeah.
help you, regain your health and vitality. But when you don't hear that,
Mm,
it's super discouraging. So me, I personally latched on to, if I saw one recovery story, I would just latch on to
yeah.
that. You have to have a certain type of mindset to be able to put in the work that you need to do to rewire yourself back to health. It's not an easy thing to do.
It definitely is. Okay, let me give you some pushback here.
Okay.
Here's because here's, I think, what docs are afraid of is giving people, and I think we're not balancing this well between realistic hope and false hope,
Right.
right? Because of course there's always one report of something happening almost miraculously, somebody recovered. So how do you, and you're somebody who's, a trained professional in grad school and a therapist,
Mhm.
right? Without saying something or feeling like this is like hokey, that this is like, oh, I just, you can just miraculously recover or that things just go away. How did you combat anybody pushing back or somebody saying, yeah, these are like isolated reports. This is not really the mainstream or this is not really effective. You can't heal these things. How did you have that conversation in like a science based way?
With the doctor or with my
Let's say with a doctor, or if you had like even a patient who was curious but skeptical. I'm just imagining even somebody watching who's like, all right, I'm curious, I've got chronic pain, but I don't want to feel like, oh, like, I drink pH water and I'm going to be better. There's always somebody selling miracle cures.
Yeah, I always say go back to the science.
Mm,
It's hard to argue with science.
mm,
There's been MRI scans done of people going through different mind-body approaches, and it'll,
mm,
it'll show their amygdala is just
mm,
completely lit up,
mm.
their fear response in their brain.
Right.
And then after they go through treatment, mind-body connection treatments and things of that nature, it's like shut off. It's like not
Mm,
lit up like a Christmas tree anymore. So like there's your evidence right there.
right.
That's what's controlling your pain. That's what's activating the danger response in your brain.
Mm,
So I think being a little bit sciencey, you kind of have to, because if you're not, it sounds a little bit like woo woo
right. 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 Right.
and almost a little bit like no one's really going to take you seriously.
Yes.
So I'm very sciencey when I talk about it. I describe what's happening in the brain and that it's basically a false signal that's being sent
Mm,
and it's
mm,
it's stuck and we have to learn how to make it unstuck. Your brain essentially learned
mm,
to be in pain. It's a really bad habit, and like any other habit, you can get your brain out of that habit. You just have to direct it to do so.
mm.
And these pathways can take a while to form again.
Right.
And that's the hardest part.
That's the kicker, right? Because
Yes.
let's be honest, right? We both been on the other side of a patient or a client that we're trying to help, right? And we're trying to say, hey, this learned behavior, this pattern, whatever it is, formed over a decade. It's not going to go away in 10 minutes.
Right.
So it takes like a dedicated end on both of us to be able to do the work and to like
Right.
do something different entirely, which is a lot harder than taking a pill.
It is. But the unfortunate piece with that is that pill won't gain you back to 100%
Mm,
remission. It
mm, mm,
might
mm.
get you to participate in activities again and
Right,
function a little bit here and there, but when you rewire your brain, maybe people need it in conjunction with
right,
medication and that's
right, right, right.
okay. But just the medication alone won't create entirely new pathways.
I'm with you. And I think the data says that whatever it is that we're treating actually in mental health, right?
Right.
We were talking about this on the way here, even talking about anxiety, talking about depression.
Mhm.
You know, we as a society right now are in this weird space where we are simultaneously over prescribing meds.
Right.
We've prescribed more SSRIs than we ever have, and we are under treating depression and anxiety. Both of those things don't add up, right? If the answer was just, and again, I prescribe meds every day. I think meds are life saving and wonderful, but they can never be the full story. If they were, we would have been good by now.
And I tell people that all the time. Like if there was a cure, then no one would be in therapy.
Yeah.
No one would be going to see a psychiatrist. You have to be willing to put in the work yourself.
Mm,
And I think if people trust in the science enough and have enough faith in themselves, then that'll get them to actually put in the consistent work
mm.
that needs to be done to heal.
I love the way you're framing that actually, because part of this is really about before you as the therapist or the doc are doing any of the therapeutic work, the patient really has to be empowered. The person has to feel like hopeful that
Right.
something can actually happen,
Right.
and then you can walk them through the steps. And maybe we can actually dive in a little bit of these. I was trying to research some of this before we came in terms of what specific techniques or
Yeah.
that would be wonderful. Let's say
Absolutely.
at this point of the pod, I'm sold. Like I heard Alyssa, I heard Mina, and they got me. And I want to learn more about how to develop, how to build a new pattern.
Right.
What are some steps that I can begin to take?
Absolutely. So I would say the first thing, you probably want to go to a therapist that specializes in trauma because they'll
Mm,
probably have more of an idea of how
more
to
toolkit. Yeah.
help you,
Mm,
resolve some of that.
mm-hmm.
But then there are different treatment modalities that science have shown
Yes.
that rewires your brain.
Mm,
Meditation, mindfulness, visualization, exposure therapy.
mm,
So what I did in the beginning of my journey with my chronic pain was without a therapist. This was just completely on my own, just through my own research and kind of understanding how the brain worked.
mm,
Is I would expose myself to things that I was afraid of to try and break the association between physical activity causes this pain.
wow.
Because the more that you avoid something, the
yeah,
more that
has
perpetuates.
power over you. So you were
Exactly.
doing like your own exposure on yourself,
I was like my own
just
like
out
guinea
here.
pig.
Okay.
Yeah.
Okay.
Yeah, and I would do a new exposure every single week in the gym.
Just
So
a
I
mad
was
scientist in the lab, just
yeah. And like no one knew what I was doing, but I was
right.
doing a whole like science
You
experiment in
got
my
some looks
workout.
in the gym though, for sure. That was
It was all mental. I was just talking myself through it. But I'll never forget there was one day I was training legs
mm,
and I had it was my right leg that was one of my many problem areas and it always hurt so I avoided it. I would do my hamstrings and I would train my glutes and my calves, but I was just so afraid cuz I was like,
mm.
it's going to make it worse and then that fear, made everything even worse after that. And I was like, okay, well that's not serving me because that fear and that avoidance is making that pathway of pain
Mm,
stronger. And that's not what I want to be doing. I want to be jumping on that other pathway that's going to break that
mm.
and dismantle it a little bit. So for me to do that, I have to face it. And with that, I have to approach it in a different way. So, however it turns out, it's okay with me. I could handle it. If I train my legs and my quads and it hurts after, I can handle that. I can
Mm,
implement my coping skills and I can handle it.
mm.
But I know that over time, if I do it again and again and again, I'm teaching my brain that this is safe. And if I'm not freaking
Ah,
out, so I'll never forget that one leg
mm.
day. At the end of my workout, it hurt the whole entire time. I was walking out of the gym, gone.
Wow.
There was no pain left in my right, and I was sold. I was sold. And then from that moment on, I did. I started wearing heels again.
Mm,
My chest was the scariest for me because of the
mm,
lung, and that
mm,
that debilitated me. I think more than anything, minus the fatigue.
mm,
And I would just do an exposure with everything I could think of, and it did hurt. And I says, "This is normal.
mm.
This is the pathway that is very strongly entrenched, and it's going to take time, and
Right,
I'm
right,
okay
right.
with that." And within 3 to 6 months, I was able to rewire my entire body out of
Mm.
chronic pain through that exposure therapy.
That is incredible, especially given the fact of, not having a guide, not having somebody who sort of walk you through. Because as you said in the beginning too, it's important, obviously, to have that line between, what is a normal pain to push through, what is a familiar pain to push through,
Right.
while not ignoring your body, right? If your body's saying, hey, no, this is like weird pain, my other lung might get punctured or something,
Right.
to have that boundary. And it sounds like it would be even more effective or really great if somebody's listening and they're able to have someone walk them through,
That
you know?
that's key. It's hard to do on your own. It's
Yeah.
really scary to do on your own. You want to start small, you want to start
Mm,
gradual. It could be a very daunting process and
mm,
very anxiety provoking.
yeah.
But you are, breaking that association when you do that.
I love that. Okay, so that's definitely one very
That's
practical
one.
technique in terms of exposure. People talk a lot about meditation, and I'm curious, let's say somebody has heard a lot about meditation and its impact on chronic pain, but they've never really tried it.
Mhm.
What's something that you would recommend to a patient? Like, all right, here's like a little intro to meditation piece. This is what you should do. How would you sort of walk them through the beginning stages of wanting to meditate?
Always back to the science.
Mm,
Science shows that it rewires your nervous system and your
hmm.
nervous system is what got you here.
Yeah, yeah, yeah.
So if you want to be able to heal, you have to consistently do these practices. You can't just meditate once
Yeah.
and heal yourself. You can't just
Did it? It didn't work.
visualize
Yeah,
once
yeah,
and heal yourself. It won't work.
yeah.
It's like one rep at a time. So I recommend starting small
Hmm.
because you don't want to overwhelm yourself and say, "All right, I'm going to meditate every
Yeah,
single
yeah,
day for 20 minutes and be super
yeah.
committed to this."
But what does a rep look like? Like, what does that first rep of meditation look like? Some people think, okay, sit there and like empty my mind, but I'm thinking about how much I'm in pain.
Right.
So what do I do?
And that's okay. So
Yeah.
that's part of the process. You just
Mm.
bring it back. You bring it back to the breath.
So walk me through it. I'm about to meditate right now. What do I do?
Okay.
So I come, I sit. Do I sit in a quiet place?
Yeah, I mean most recommended in a
Not in the
quiet
middle of
place.
Times Square in New York City.
I mean you could build up
Oh
to
man,
that.
that's high level meditation.
Yeah.
All right, so I'm in a quiet space,
Mhm.
and do I close my eyes?
I would recommend starting with your eyes closed.
So
Yeah.
close my eyes, and then what do I do?
Okay. So you want to make sure that you're inhaling, but through the stomach. So put your hand on your stomach. Okay, and then breathe in through the nose. And your stomach should be going out. Okay. But what I want you to do is inhale for 4. 1, 2, 3, 4. Belly, not chest. Hold it. 1, 2, 3, 4. Now exhale through the mouth. 1, 2, 3, 4, 5, 6, 7, 8. Exhale always longer. Exhale always longer than the inhale.
Wow, I feel better already. The reason I'm going through the nitty gritty is I feel like meditation is one of those like buzzwords that people hear a lot, but no one really sees it demonstrated. No one really practices it in a live way. Here we are. What a great opportunity to walk me through. So the act of inhaling and holding your breath, controlling, we talk about biofeedback, right?
Mhm.
People sometimes don't know that you can control your heart rate.
Right.
Right? You can have an impact on, there are several of these biological markers that you can manipulate.
Right.
Right? So I don't know if I cut you off in the middle of the meditation.
You're fine.
Is there more? Tell me.
I mean, you want to do more than just one.
So that was
you
a
want to
set.
start with 2 to
That was
3
like a rep.
minutes
Okay.
both in anxiety and non-anxiety provoking situations.
Nice.
It's more effective when you practice it when you're not anxious.
Yeah.
We'll touch on visualization after because I think that that's even better.
I like that one.
Yeah.
Yeah, I like that one.
Yeah.
And I love the point too that you're making about like you want to do this not only in the stress response, because people often will tell me, all right, Dr. Mirham, I'm having a panic attack. Like, how do I break it?
Right.
Like, that's cool. There are ways that you could break a panic
Mhm.
attack, but it would be really nice, when there's a fire to know in advance where the exit is, right? To have built up some of these tools. So to your point, if you've got some of these reps in place, if you're able to sort of practice this and know this is my go-to, when I inhale this way and I hold it for that way, and like this like belly breathing, how much of a difference that can make.
Right, absolutely. And over time, eventually you become a little bit more stress resilient if you're consistent with those practices. And you'll find what used to really stress you out, you're a little bit more calm in those situations because you're rewiring your nervous system. But I think the biggest thing in rewiring chronic illness is visualization.
Ooh, let's talk about that. If it's the biggest and the best one.
It's the biggest and the best one. And I'll tell you why. Your brain cannot distinguish what you're imagining and what's going on in real life.
The brain sounds kind of dumb. I don't know. Just
Wait, say it again.
So the brain sounds kind of dumb. I don't know. I thought it would do a better job.
I know, right?
Come on, brain. Come on, man.
I know. It can't even tell. You might use your imagination to your advantage.
Yeah, there you go. I love that.
So I'll start. So for me, what I did was I visualized myself exactly how I wanted to feel. So I ignored what was going on in my current reality. And I meditated first because for visualization to be most effective, you want to self-induce that relaxation response, which meditation does. So you want to start with about 2 to 5 minutes of meditating and then go into a visualization. You can do a guided one, you can put music on. But let's say you're someone that has food sensitivities like I did, pain like I did, debilitating chronic fatigue like I did. Because at that point when I started visualizing, it was the food intolerances and it was the fatigue.
Okay.
So you have to get crystal clear on what you want. So if you don't want to be in pain and you want to have an abundance of energy and you want to be able to eat the foods that you want to eat, let's say you have IBS and not something like celiac or IBD or anything like that, that was ruled out.
Yeah.
Envision yourself doing the things that you want to do, feeling abundant, feeling like you have so much vitality. So for me, I would go for runs. I pictured myself moving across the country to San Diego, which I eventually did end up doing.
Oh, nice.
So that was
a beautiful place.
That was my, it really is. Going out to eat with my friends, eating foods that I wasn't able to eat. I was down to 87 pounds and I could only eat 3 foods.
Wow.
So in your brain, it's thinking that you're engaging in these experiences and it's activating those same mechanisms in your brain as if you're really doing it.
Cool.
So over time, if you do that again and again and again with as much, this is the kicker too, as much positive emotion attached, because that's what creates changes in your brain, really negative or really positive emotions. So the negative emotions got you into a bad place. That visualization with that positive emotion, that's what's going to create faster neuroplastic changes.
Oh, I love that. I love
Yeah.
that. I remember, I've seen this in one version of this, like working with athletes sometimes, when you see a star athlete who's saying, when I was in that pressure moment in the finals, I had visualized, I pictured it.
Yeah.
They don't use visualize, I pictured it
Yeah.
right in the backyard, but I can see, Kobe, RIP, used to talk about this of just like feeling like in practice, he practices with the same intensity, with the same emotion that he would in the game.
Yep.
And I think we probably undersell ourselves on the visualization piece and of like how powerful this can be for us.
It is so incredibly powerful, and you'll see the biggest athletes, they talk about it. Like Michael Phelps,
Mm,
he visualized everything going wrong.
mm,
So so that what he knew what to do. In the Olympics just now, there was a girl that won track, and they interviewed her. I forget her name, but she's like, I visualized myself in my head. I already won. So you have to
wow.
really believe in the power of it.
Yeah, yeah, yeah.
But again, it really comes down to intensity, frequency, and duration. So you're not going to visualize one time.
Yeah, yeah,
And
yeah.
I don't want to discourage anyone, but I was in a really bad spot. I was dysfunctional. I was a shadow of myself.
Mm,
I couldn't work. I couldn't work out. I couldn't do anything.
wow.
So I was in a really bad state. So for me, I visualized in 15-minute segments 3 to 4 times a day
Mm,
for 18 months.
that's intensive work. And I want to make a distinction here between this sort of science-based visualization versus this is not, happy thoughts. This is not just like, rubbing a genie lamp and like hoping things go well. This is not just
Right.
like sitting there and be like, um, I'm visualizing, winning the lottery. And this is not manifesting in the sense, right? This is more so about literally in your mind's eye when you have this scene,
Mhm.
right? And in the same way that we know this, it's very well established in a negative way with trauma, right? How we can relive a past negative experience.
Mhm.
The flashbacks of PTSD are as vivid as the experience itself. And
Mhm.
the body reacts to it, like you're saying, that sympathetic response is real. That fight or flight is real the same way that you felt it in the trenches, of the war. So I just wanted to sort of put that context to it because sometimes people hear visualization, and again, the woo-woo, version of it
Yeah.
is like, oh, this is like happy thoughts, or I'm looking into the universe and everything will be great. It's not that. There's a science to it.
No, and if the universe, God, source, whatever is your faith in helping to keep you
Yeah,
going,
yeah,
absolutely. Actually, with PTSD right now, they're actually using virtual
right,
reality
right, right,
to
right.
kind of like resimulate it in a safe therapeutic setting to kind of like
Yeah.
rewire it. So it is incredibly, incredibly powerful. It has been proven to rewire the mind, to enhance adaptive
Mm, mm,
neuroplasticity. And that's what we want. That's how you self-direct those changes in your brain
right,
to
right, right, right.
cultivate the physical changes in your body that you want to take place. So again, it's repetition, it's
Mm,
positive emotion, and more importantly than that, I would say try not to talk about it too much.
mm.
Try and not make it like in your Instagram bio, like
Right, right, right.
chronic pain, because people they really start to identify with it,
Ooh,
and
that's
that's
good.
yeah,
That's good.
yeah,
Which is tough because there's two sides of this, right? And having seen patients who are struggling with this, there's a validating part of like, oh, this is why group therapy is so effective. It's like, oh, we're all
yep.
going through this. This sucks, right? But there's a part of this that's also, this is not my whole personality. This is not who I am entirely.
Exactly, and unfortunately, like, the more you talk about it, the more that you keep those pathways alive that you
Mm,
wanna dismantle.
mm,
Because whatever you talk about, you're signaling to your brain, "This is really important."
mm,
So if the ideal version of you doesn't wanna be sick, the more you talk about sick and you hear other people talking about sickness,
mm,
you're identifying with it more.
mm.
You wanna maybe look you might maybe, like, make a vision board of things that, like,
Right,
you look forward to doing once you are healed, but if you just visualize and then you get up and you're like, "Ow," and this, and
right, right,
it's
right,
not
right.
working, like, it's gonna counteract it a little bit, so it's what you do outside of that as well, and
Yeah,
who you're
and who
surrounding
you're with,
yourself
your
with and
community.
stress and all
And
that.
you mentioned also, having this anchored in something, right?
Yeah.
I think anchoring this, one anchor, I think, is the science behind why you're doing it.
Mhm.
One anchor for some people, as you mentioned, is faith or being part of a spiritual community. I've seen a lot of patients where, being in a church and being around other people who are sort of encouraging me and reinforcing for me to think in a positive way. And my anchor there is around, a spiritual being, if that's God, and their love for me is very powerful. It's very liberating, and it sort of encourages you to be on the same positive pathway, as opposed to feeling like there's nothing that anchors that process. Because as I imagine, I guess maybe tell me this: the same way that you're going to the gym, and you gotta, to get results, you gotta put in all these reps over all these months.
Right.
This mental gymnastics process must
Yeah,
be exhausting.
it
So how
is.
do you deal with the exhausting part?
Once you start to notice reaping the physical benefits, like
Mm,
for me, like once you have your first mini breakthrough, like what
mm,
I did, I had a calendar and I would put a sticker if I had one day where I had even 3 hours where I didn't have
mm.
fatigue. I was like, okay, the neuroplasticity is working. I'm
Yeah,
creating changes. Because then what happens is you have a bad day and your brain will forget that you ever had a good day. It's be like,
yeah.
this isn't working. So
Mm,
you have to have some kind of reinforcement system. You have to show your brain evidence that it's working. But I think people have to go into it knowing it could take 3 months before you
mm.
notice any benefit, but you have to trust that changes are taking place in your brain
Yes.
before you actually reap the physical results. Just like the gym. You go to the
Right.
gym, you're lifting weights, you're not gonna be jacked in a couple weeks. It's the same
I
exact
tried. I
thing with
tried to go once. I didn't get jacked that one day. So,
I wish it was that easy. In
right,
a
it'd be nice.
society, we love instant
Yeah, that's what
gratification.
we're trying to do.
But
But you're right though, and I think that's part of the benefit too. That if there's somebody there that can remind and reinforce, because on a tough day, I'm sure without a doubt, there's gonna be that feeling. You know what? This is useless. This is not working.
of
I
course.
feel even worse than I did 3 months ago, and I've actually seen this in patients. It's interesting. I can see somebody who's been, let's say, in therapy and getting treatment psychiatrically with medication.
Mhm.
6 months later, and they can come and see me on a bad day. They can say, "Ah, I feel like I'm even worse than I was." And in my mind, I'm like, dude, I see you weren't even functioning 6 months ago, bro. You weren't even going to school. Like, you don't even, it's hard sometimes to see the same way maybe when you're young and you don't realize when you're physically growing. You don't know that unless somebody has a little chart by the door.
Yeah.
It's hard to tell your own growth.
Yeah, it really is. I see it in therapy all the time too, where people are like, like sometimes they're a little bit ambivalent about their change, and I'm just like, all right, let's go back to day
Yeah.
one.
Let me remind you.
Yeah, yeah.
You know what? Actually, speaking of remind you, I wanted to catch something that you said earlier that I think is so important too. In addition to chronic pain being this huge topic, right? As we said, it's a hundreds of billions of dollars being spent in healthcare on this. It's the reason why 25% of folks in that category are taking opiates. The other category that you mentioned are GI issues, whether it's IBS, things
Yes.
like that. It's
Yes.
another area where in medicine we're like, maybe this will help. Actually, I had one of my best friends who's a physician had these terrible GI symptoms,
Hmm.
and it turned out to be, partially due to some rare GI thing, but the rest of it was like mind body.
Yep.
If somebody's dealing with like horrible IBS, GI symptoms, maybe share with us a little bit of what your experience was like with that and what sort of encouragement you'd give to that person.
Yeah, it's funny you say that. My brother's a
Oh,
gastroenterologist,
nice.
and he tells me all the time that he
Mm,
has patients, and it's hard. It's hard to
mm,
know what to say, and I think that you guys probably get people that are like, no, like give me a colonoscopy, give me
right.
an endoscopy. There's something here, and sometimes you go looking for things and you find things, which I did,
Mm.
and I was misdiagnosed with C. diff, and I took antibiotics for 6 months that I didn't need.
Wow.
So
Okay.
I mean, sometimes you search a little bit too hard, but you want to
Yeah.
rule things out. But if
Sure.
everything is ruled out, we know that the mind and the body influences your
The gut.
yes,
100%.
yeah, without a doubt.
Yeah.
So things like visualization, meditation, but also for me was exposure therapy for food. My brain
Mm.
was terrified of eating certain foods because I was like, oh my gosh, I'm gonna have to run to the bathroom, or I'm
Yeah.
gonna be up all night with stomach cramps. How am I gonna function? I'm gonna be like super bloated and I'm gonna look ridiculous in this outfit. So
Right.
that starts to create more gut issues. And
Mm.
so what happens is you start to create even more sensitivities. So what might start out with like just a little bit of IBS, you start obsessing over it.
Right.
You're creating that new pathway. Then your brain becomes even more fear-based and more sensitive to things,
Mm.
and you get even more food intolerances. So exposure therapy is really big with that. I would say with food, again, that outcome independence, starting with something that you're not terrified but
Right.
you're willing to try. And
Right.
then if you do, for me, I had to do it maybe 5 or 6 times, and it was like,
Okay.
oh, it stopped, it stopped. But I had to visualize too. I visualized, I
Wow.
exposed, And I was very, very conscious of the stress
Mm.
in my life and how to mitigate that.
This is huge because I think people don't often realize how you can perpetuate symptoms so much. You
Yes.
can give them a kind of power over your life. And this is again, like again, disclaimer with all this. I'm not saying, you're allergic to something and you're gonna like break the allergy. We're not talking about that. We're talking about something where there's an insensitivity to a food. And just like you're saying, especially socially too, a young person, let's say you're dating, right? And you don't want to be like in the middle of a date and have explosive diarrhea. That's like
Right.
that's the most terrifying thing ever, right?
Right.
So people just wind up, like you're saying, actually perpetuating things much more
Yeah.
and not realizing that. I remember having a discussion with a patient once. He said to me, if I go to this one place, I'm going to get anxious. And we had to discuss a little bit of like why being anxious in a place is not the worst thing in the universe. Why you can be anxious and still do it anyway, kind of
Yeah.
thing, as
Yeah.
opposed to avoiding it and becoming more and more anxious.
Yep.
And that sounds very similar to how we relate to food.
Yeah, absolutely. The avoidance surrounding it, the fear surrounding it, the what's going to happen after,
Mm.
all of those things perpetuate it because, again, you're activating those fear receptors, the danger response in your brain, which is only going to make things worse.
Man, I can really see that. And in a more maybe even concrete way, do you think the kind of food, I know you were saying introducing yourself to some of the foods that you were afraid of or
hmm
sort of worried about, do you think the kind of food that you ate in terms of healthy versus unhealthy that also had like an impact?
My goal was really to be able to eat every single food again,
Nice.
and I
It's my goal.
I achieved that goal. So I
Nice.
mean, occasionally I'll get like maybe some stomach. I may sometimes with onions, it'll bother me for maybe 20 minutes.
Sure.
That's honestly the only thing that I
Okay.
have
Okay.
left. So I eat healthy for the most part
Yeah.
in
Yeah. Yeah.
general, but if I ate unhealthy foods, it's not going to upset my stomach
No, I
anymore.
got you. The reason I guess I'm asking is, there are all these discussions around sort of nutritional psychiatry, nutritional mental health,
Right.
and about how, if you're on the Mediterranean diet, I was in Europe recently and you just feel differently when you're eating organic food.
Yeah.
Even if you're eating, I wasn't eating healthy the whole time, I was eating as much as I can. But here, when things are a bit more processed and high sugar and things like that, that has somewhat of an impact in the way that we feel,
Oh, absolutely.
right?
Yeah, part of my journey was trying to get as much nutritional value as I
Yeah.
could in, and with that, instead of eating, I don't know, like a cheeseburger, maybe I
Yeah.
would
Yeah.
have like a salad or something
Sure.
like that.
Sure.
Because
Sure.
I just wanted to give my body the proper fuel to
Mm.
kind of be an adjunct to what I was already doing.
Mm. It sounds like both with the food that you were eating and I guess the way that we're approaching this as we're sort of coming to wrapping up is it's not so one track minded. It's not so singular in terms of one thing is making me sick, one thing is making me better. It's all of these different dimensions and how we can put all the resources together for me to really, be better. But the part that I just want to underscore because I think we're missing so much in healthcare. We don't do a good job of this as the sort of paternalistic doctors that we can be, is making sure the person in front of you feels that they can control their health. You can like take back control to a lot of things and
Yeah.
you're not a passive observer to your own health,
Right,
you know?
right. I think just what you said alone right there
Mm.
could be enough to empower someone to maybe go a different route, to maybe try
We're gonna
therapy.
trademark that. That's gonna be
Like that little simple statement.
mm,
I think that's what I needed. I
mm,
didn't need to hear we don't know. I
yeah,
never saw someone that got better. It's
mm.
incurable. Like just that very, just what you said. Like that was perfect.
Oh,
And
thanks.
sometimes that's all someone needs. And
That's
it
so true.
instills hope.
Right, right.
Like you have some control over your diagnosis
Yes,
and your health.
yeah, yeah. And I think it's consistent too with the science, the data that we know.
Yeah.
There are very few things in healthcare that you have zero control over. Nothing that you do will matter at all. Even if it's like a terminal cancer, in the moment, in the day, the way that you're gonna feel based on the choices that you're making, it'll change based on the choices that you're making there. And we know prognosis wise things change there too. So I think that empowerment part is something that's it's a big part that we gotta keep reinforcing for folks and for ourselves too. I think we want to make sure that our health is something that we are empowered and we can take control over and it's not entirely outside of our control,
No,
you know?
absolutely. There's little subtle things that you can do that'll make a big difference. Obviously, if you're completely chronically ill, you have to put in a little bit more work,
Yeah.
but there's subtle things that you can do that will really make you feel a lot better. Just sleep hygiene, eating well,
Yeah.
going for walks, limiting screen time, like little things that'll
Yeah.
just make a big difference.
I love that. So as we're coming to a close, if somebody wants to learn more, and I know I would recommend if somebody's watching and wants to see a therapist who is specialized in chronic pain, has their own background from a personal journey,
Mhm.
has done the work, done the science, they can see you. Where can they find you? How do they come to you?
You could find me on Instagram. It's at Let's Train the Brain. It's pretty easy to remember. Psychology Today, Alyssa DiLeo, ALYSSADILEO. I'm on LinkedIn. Yeah, you can message me on LinkedIn, follow me on Instagram, call me from Psychology Today. But I'm kind of all over a
Kind of
bunch of
there,
different
kind of
things, so
there,
you could find
accessible,
me.
accessible. Okay, awesome. Let's say as we close, is there? I know we kind of mentioned it with the empowerment piece, but is there anything that you'd want to leave the person watching with if they just got a diagnosis maybe of either a GI issue or fibromyalgia, chronic pain, and they've stumbled upon this? What's something that you'd like a parting thought you'd want to share with them?
This is absolutely not something that you are stuck with and that you have to live with forever. The brain is highly malleable. It
Mm,
could change your entire lifespan. And if you put in the work and you are super consistent with it and you don't give up the faith, your brain has no choice but to change
mm,
if you train it. It's inevitable. If you train your brain, it's going to change and you will reap the physical benefit. It's just a matter of time and you have to let go of that when. I know
mm.
you want it right now, but we don't know when it's going to happen, but it's inevitable if you put in the work and you train the brain.
I love that. Let's train the brain. Let's train the brain. Well, thank you so much, Alyssa. This was wonderful, and thank you
Yeah.
for tuning in. Please continue to follow us here, Mind Your Health Pod. And again, I'm Dr. Mirholm, and it's been a wonderful pleasure to hear about this. This is very inspiring, hopeful, science based, like evidence based hope. I think is the thing that we need the most.
Yeah,
Not hokey pie in the sky kind of hope, but real anchored, realistic. It's not going to get better over a second. It's
right.
not going to be a magical supplement that you gave me for 5 easy payments of 1999. But it's real and it works, and you experienced it. So just thank you so much for taking the
Yeah.
time to
Thank
chat.
you for having me.
Appreciate you.